Many people in chronic pain, they have a lot of emotions about feeling chronic pain. They often don't understand why they're in the kind of pain that they're in. And so there's underlying feelings of shame, could be regret, grief, lost time. There's so much energy that goes into managing a chronic pain state. There's really very little left for relationships, the potential of going out and adventuring. I'm sure that you probably had times when you felt sick. And in those times, you may not want to be around anybody. You may want to be taken care of by someone. But typically, we get better and we can move on then with our day and with our week and just our life in general. Somebody in chronic pain, sometimes the getting out of it just seems impossible. It takes an emotional toll, certainly takes a mental toll, and of course, the physical as well. And in that mental state, there can be a lot of why me? Why this? What happened to me? What did I do to cause this? What is it that I need to do to get out of it? And so it's complicated and impossible to understand without actually having a foundation of recognizing all the components that have gone into a chronic pain state. And so we know now that those components, they can be all the way back to birth, all the way back to being in baking in your mother's womb. And how was she feeling? Was she happy? Was she sick? Was she depressed? Was there something major going on in her life that was negative? If you're born into this, there can actually be a lot of complications in your own brain where that mirroring, that happy, joyous mirroring that's supposed to happen in those first couple of years, it doesn't happen if you happen to have a sad mother or maybe a young mother who just doesn't really know how to take care of you. And so your brain, all the way back then, begins to create the stress. It begins to have stress about the world. You begin to experience the world as not happy and not joyous and maybe difficult. Little children then will begin to think that what's wrong with me that I'm in the situation? What's wrong with me that I'm creating this? Because all little bitty children think that they're creating the world, which is they're supposed to. But if they're having a joyous world, they learn to create a joyous world. If they don't have a joyous world and if they have an unhappy world, they learn to create an unhappy world. That tension then in the brain, it begins to work on those aspects in the brain that over time will form a chronic pain state. It's more depression, inability to be happy or find happiness, difficulty initiating, just being able to move out into the world and initiate. Right now, that's a difficulty that many younger people are having and children are having just because we came through the pandemic. And what many of these younger folks learned is they to sit still. They're not supposed to sit still. That's not their age. They're supposed to be out and moving and enjoying their bodies and enjoying their friends. And instead, they had to sit. So many of them lost their ability to initiate. And even now they struggle. You may be somebody who actually struggles to initiate, and it maybe not before the pandemic, but now after the pandemic, you've learned to sit, maybe learn to wait for things to come to you rather than going out and grabbing life with that kind of gusto that we're supposed to go after. And so that supports a chronic pain state also is that lack of movement. I think it's fascinating that our brain kind of forgets that we have a part, a body part, if we don't move. So we can lose this connection. We can lose our embodiment. We can lose our ability to connect to, say, the top of our feet. Think about that for a moment, the top of your feet. Many of us don't feel that because it's just not something we think about or consider. But if you go to the top of your foot right now and feel that, Do you really feel it? You might even use your fingers or your hand or something to go actually feel it. What does it feel like? In our brain, then in a chronic pain state, if we're not moving, a couple of things can happen that we can forget we have that place in our body, which then morphs that pain rather than being specific. It can be like an all over experience. The other thing that can happen is that this area in the brain that I talk about called the homunculus, that body map in that area, it gets a little squishy, for really technical term there, widens itself, that it gets bigger and broader because you're not moving. This part of our brain actually begins to lose the definition of body parts. And so if you have chronic pain in, say, an elbow, over time, if you're not moving it, that pain may actually get bigger and broader, and you might feel that in more of your arm instead of just your elbow, because that body map and your brain and those neurons begin to move out and take up more area. And so really understanding the chronic pain state and how it encompasses stress, how it encompasses movement or the lack of movement, initiating behavior, our own behavior towards it, our own feelings towards it, that we're not helping ourselves if we're beating ourselves up, because that's for anything. Beating ourselves up, we're not gonna thrive. Thriving comes from joy. Thriving comes from enjoying life and friendships and being appreciative of the body that you have and the life that you have. Your life belongs to you, and you can do anything you want with it. And in a chronic pain state, it doesn't feel like you can do anything you want with your life. It just hurts. And so the hurting part, once you get to the place where it hurts and it chronically hurts, meaning that it hurts all the time, there is a whole lifetime of events and thoughts and emotions and movements and behaviors that have culminated into that chronic pain state. And so all of those things need to be addressed in some way to begin to undo that. And that takes time. And it can sometimes feel like it can take forever. And why not? Why not move towards your pain rather than away from it? One of my very early experiences of chronic pain is that I had a frozen shoulder, and it was my right shoulder. Right shoulder wouldn't move without extreme pain. And I don't remember doing anything, don't remember overusing it in any way, but it hurt so much I stopped using it as much as I could. I'm left-handed, so it was easy to not use my right side very much. And I don't know where this idea came from. My brain just gave me a thought at some point that said, talk to it, talk to the pain. And so I thought, that's silly, of course. But you know what? I'm going to talk to this pain. So I started a routine every night before I went to sleep. I would say to the pain, I don't know why you're there. I wish you would tell me. I would like to communicate with you. What is going on that I can't move? And then I'd go to sleep. In the morning, I would say the same thing for just a minute or two and then move on with my day. It was months. I don't know if it's been so long ago. I don't really remember the time frame, but I know it was a long time for me. But one night I was doing this same routine, just a minute of checking in, what's going on? Why are you there? And then in the next moment, I felt the deepest terror that I had ever felt and an electrical shock that went through my body. There were no words. It was a feeling and an emotion. The emotion was terror. The feeling in my body was like an electrical shock. And it went through my body in probably less than 5 seconds, and it was gone. The pain was gone. My arm could move. I have no story around it. I have no idea why it was there to begin with. And I don't know particularly why it decided to leave when it did, except I understood at that point that I reached out. I moved towards my pain in my brain. I was very curious. I kept out talking to it. Wasn't bitching at it. I wasn't telling it was bad. I wasn't doing any of that. I was just simply connecting to my body and wanting to re-inhabit that place in my body that I'd lost contact with. And so that was a skill I learned, and it's a skill that I actually teach people that I work with. And again, it took a long time, but it worked. And so it's one of many things that might work. And if you're somebody who wants to work with people, say you're a licensed therapist of some sort, or you're a body worker of some sort, that really understanding all the components to chronic pain will help you get a foundation, will help you have a foundation where you can be supportive of these folks and really come from a place of compassion, of understanding. It's quite a complicated situation to reverse, but it is possible. And so even if pain doesn't go away completely, when we manage the behavioral aspects and the self-talk and the emotions, we can get rid of a lot of the pain, a significant amount of the pain, although it may not get rid of the pain completely. There are segments of your life that you can regain by going through a process of reclaiming yourself.